CFBHN is a not-for-profit 501c3 corporation contracting with community service organizations to provide a full array of publicly funded mental health and substance abuse services in 14 Suncoast counties. Services include acute care, residential treatment, housing, medical, outpatient, recovery support, and prevention. Our friends from CFBHN are up next on Bayside. Good morning and welcome to Bayside. I'm your host, Shelly Sanders. Like I said before, we're talking to our friends from CFBHN, Central Florida Behavioral Health Network. Now, Doris, I would love to welcome you back to the show. It's always a pleasure to see you, and you know, you bring people with you every time that's so relevant and so important to have them here. And so without further ado, you've brought Natalie Kelly. Now, Natalie is the director, correct me if I'm wrong, executive director for the Association of Managing Entities,
That is
right?
correct. Yes, ma'am.
Now, I know every time you see me, whoever we're talking to, we always give you all those complicated big words and long titles and everything. Let's just stop for just a second and explain it really simple to our viewers. So we've got CFBHN. We're talking about the if I can even talk today, opioid crisis here in the state of Florida, and more importantly in our area. That's why we are on Bayside. But you can't do this over these 14 counties, Doris, all alone, and you do need help. And there's also people that you need to reach out to and give the information that you guys are collecting so that it gets in the right hands of those decision makers. And that comes into play with Natalie, am I right?
That's correct.
Let's talk about that opioid problem.
Well, one thing about the opioid crisis is when we came before, we were sort of in the early stages of implementing the grants that came from the federal government to our area. And, you know, the state received $27 million the first year. We're in the second year now with approximately $27 million, and that equates to about $5 million for the Central Florida Behavioral Health Network area of 14 counties. Much of that is spent right here in Hillsborough County and Pinellas County because of population. Spending sort of follows population trends, and it provides medication-assisted therapy and outpatient treatment. In the first year, for instance, we serviced about 950 people with the funding. Second year, we serviced almost 4,000 people.
Wow.
So we got the infrastructure in place, we got everything set up with our contractor providers who are well prepared to do this type of work, and we were able to service that many folks in the system of care, getting them into treatment and recovery. One thing you mentioned that's very, very important that we know works well for us as well as throughout the state of Florida with the managing entities is collaborating with local other type of providers, the emergency medical technicians, county social services, law enforcement in the court system, the public receiving facilities like hospital emergency rooms. We have to be collaborative with all of those groups to help people where they show up. In addition, we do prevention services in schools where we serve about 7 million children and families in the course of a year with educational messaging.
Oh, wow. So with all of this information and all that collaboration with other entities, Department of Children and Family Services, etc., with all of those, you're able to bring the information of these 14 counties to Natalie. Natalie, talk to me a little bit about, that's quite an undertaking. First of all, the first time I met Doris, I thought, gosh, 14 counties. Woman, how do you sleep? I mean, when do you sleep? That's a lot to handle. And now here, taking it a step further, you being the executive director of this association, you've got the entire state. So what is it that you can say as Florida, what is going on here? Obviously, this is a nationwide problem, but what's happening in Florida here, and why is this such a crisis?
So let me go back just a little bit. Before the legislature created the managing entities, it was a decade of, or several decades of an antiquated system where dollars just flow right directly to certain providers, and then there's limited accountability. Now the legislature then responded to that and said, you know, we want to test this out, see if it works. It did, and now it's gone statewide. So we have 7 managing entities, and Central Florida Behavioral Health Network is one of those managing entities in this area. So what the managing entities do, we manage, administer, and make accountable the taxpayer dollars. But what's so special about the managing entities is that it's localized. So we don't have big Tallahassee telling you, your viewers, what services that need to be done, because the community makes that decision. So the managing entities are made up of community leaders on their board. And besides that, the managing entities know how to develop a system of care. Okay, so before, when you're dealing with treating a person with opiate addiction, you're treating that individual. But what the managing entities do, they also contract out with providers that provide additional support that takes a more of a holistic approach. So if that individual needs housing, then we contract out with a provider for housing opportunities. If they need employment, we find a provider that helps them with employment or helps them with interviews or interviewing or resume building. If they need transportation to that job interview, we find providers that do that as well. So this is a more holistic approach, and this is about focusing on the individual, not about the system, not about the providers, but the individual and what is right for the individual. And with that, then you break down those walls of silos, meaning we're just not in the children and family world anymore. We deal with law enforcement, and you have a great example in Pinellas County where the managing entity partners with the local sheriff. Also, we go into the counties and we actually do partnerships with counties. Hillsborough is a great example of the money that they now have put in, allocated into the system. And now, since Parkland shooting, we go into the school systems, and you have a great example in the northern part of the school system in your area in Pasco, where they partner with a managing entity, and they allow us to collect that data, so when the legislature comes back and says, what are you spending your money on, we can show that. So that's the managing entities in a nutshell.
And it's not just what we spent the money on. What are the outcomes? Did people get better?
Right.
Did things improve for them? Did they come back into the system? We can track all of that with our IT systems, and we can provide that information, and we can show legislators, well, how many people in your constituents received services, and how many people got better, and how many families were affected.
Sure. And it makes perfect sense, because the numbers can tell you one thing, and I love how you're taking those numbers to a whole new level, though, because before, I think treatment for things like an opioid problem or any kind of an addiction problem, it was sort of black and white. Okay, you need this and this is the treatment. Okay, good, now you're solved, whatever, your problems are gone. Whereas it goes much deeper than that, and for a community level, it really should be something that's thought about because of the ripple effects. Some of these people have families. What happens when they can't get to work? Now that employer is affected, employees for that employer are affected. The list goes on and on and on. Perhaps it's a student. Now they're failing school. Now the family is affected. You know, there are a million different outcomes, and so the fact that you're actually looking at this, going back to what you said earlier, as more of a holistic or even more of a broader scope, yes. I commend you for that, and thank goodness we're finally coming around to figuring some things out here. All right, you're looking at it right there. I know you're wondering, hey, what are we talking about here? If you're just tuning in, well, there's the website. You can go get caught up. It's cfbhn.org. That'll give you all the information and then some, everything that we talk about here on Bayside today, you'll be able to get from that website. Don't worry, we'll have a link for you on ours as well, CW44. Why don't you go check it out while we get a break. Welcome back to Bayside. I'm your host, Shelly Sanders. I've been talking with Natalie Kelly and, of course, Miss Doris Nardelli, all about Central Florida Behavioral Health Network, the managing entities for the state of Florida. And now we're joined by Senator Dale Roose. Welcome to the show, Senator.
Well, thank you very much for having me, and thank you for what you do to give information to people.
That's what we're here for. Listen, I want to say really from the bottom of my heart, I appreciate you taking the time out of your busy schedule. I know, especially this time of year, it's got to be hectic for sure. Now, you have been a very busy man outside of just campaigns and everything else under the sun, but you've been very busy touring the state as it relates to what we've been talking about today, opioid crisis here in Florida. You've been going around talking to the various managing entities, seeing what services are out there, seeing what results they've been having. You're collecting all kinds of information. Let's just get down into it and tell me what you're finding out.
Well, I'm finding out that we have some very knowledgeable, very interested, very passionate providers, people who want to help those afflicted with the disease of addiction. Workers, warriors on the streets and in treatment centers, emergency rooms, halfway houses, facilities designed to help those recover from the ravages of addiction. Even family members, community leaders are all involved in this struggle. But we need to translate that from the legislative standpoint into resources, support, help, so that we can continue this battle.
Sure, and how is that happening? How are you finding that? Is that a challenge to find that? Are we struggling in knowing who to talk to or where to take these resources or exactly where to put them? Is that the challenge?
You know, they say that politics is the allocation of scarce resources. We know what to do. We know what we need to do. We just need to commit to the resources and the talent to getting it done. We lost 5,700 people in 1 year, 2016 alone, to this addiction crisis. 14 to 16 were dying every day in this state until Parkland, when 17 people horrifically and tragically lost their lives in 1 day, and the whole world was watching. And because of that, the legislature was motivated to find $404 million to put into a School Safety Act, to save our children, to create safe environments for them. But that robbed us, and we had to make hard budget decisions that impacted other areas of the budget, like substance abuse and mental health.
So if I'm understanding you correctly, and I will tell you, we all hearts broken for that tragic day in the Parkland shooting, but we should be just as outraged and just as heartbroken for the numbers. I mean, you said again,
and since
15
Parkland,
people a
14
day?
to 16 have continued to die every day in this state. So the travels...
I mean, think about that just for a second. For you at home, think about those numbers. 14 to 16, on average, 15 people a day. 15 people a day in this state alone, in just this state, are dying from this. This is a crisis.
And we can save them.
Right.
We can help them if we just provide the facilities, the treatment, connect them to these powerful warriors who are providers out there.
Now, how do you think we're doing? Are we doing okay? Are we getting better? Or every day you're seeing progress?
Well, Natalie?
I think we're seeing progress. I really do, but let me tell you where there's a barrier.
Okay.
The barrier is the stigma of this, because people don't think that this is a disease, and this addiction is a disease. So therefore, we need to make it a healthcare issue, not a criminal justice issue, not a judicial issue, not a corrections issue, but a healthcare issue. For example, an individual with Alzheimer's, they go into a store, they walk out with something, okay, they take something away. If a law enforcement will come in, but we have taught them in the past that this is a person with a disease. You don't want to prosecute this individual. Well, the same thing is for addiction. If an individual that has an addiction has an opiate, they could go to jail because they're in possession of an opiate. We need to treat this as a healthcare issue and not a criminal justice issue.
Absolutely.
And make more treatment available versus incarceration, and do more prevention and education at earlier ages to help stem this addiction expansion.
I mean, at the end of the day, if there's more treatment, just because of the way that it happens, there'll be less incarceration. When you treat the problem, since this is a disease, you provide the treatment, it's a healthcare issue, then in theory, your legal issues from a law enforcement standpoint should digress, should go down as it is anyway. Senator, tell me, why is this such a big hot button for you? Why are you so passionate about this?
Well, because I've lived it. And they say there's nothing like a reformed or recovering addict. In our program of recovery, the therapeutic value of one addict helping another is without parallel. So when you've seen it, when you've experienced it, and God has spared you from the most dire of consequences, that's for a reason, it's for a purpose, and I'm walking in my destiny. I'm walking in my purpose.
Love it. Very well said. All right, without further ado, I'm going to send you the website on that note. cfbhn.org, that's the information. You're going to want to log on to that website. That'll give you all the information that we've talked about and then some today here on Bayside. We'll have a link for you on cw44.com as well. Don't go anywhere. Got lots more to talk about after this. Welcome back to Bayside. I'm your host, Shelly Sanders. I've got with me Ms. Doris Nardelli, who is the Director of Communication for CFBHN, and of course, Senator Dale Roose of District 19. You know, it's so important that we're talking about this. I can't reiterate that enough. There are a lot of things that we could talk about this for another 4 or 5 hours, honestly, Doris, and still not have enough time here. That said, I know there are some exciting things going on your website. Let's go ahead and tell our viewers about that, because I know that there might be some people at home that are thinking, gosh, my neighbor, my friend, my husband, my son, whatever the case may be, who needs services. Where do they go for that?
I want to tell you to please go visit our website. We have done a lot of amazing things to update that website and make it more user-friendly, more informative. There is a tab called Locator, and that will tell you exactly where the services are located closest to you. There's a map feature, and you can look at everything that is available in our area that we contract for and find those services. Another significant feature is the video programs that we have done, which are video stories about real people that have decided to share their story about what treatment meant for them and what recovery means for them. And there's just some truly inspiring stories there, because we do know that treatment works and recovery is possible.
So maybe you start there. If this is something that you're thinking, I don't know, maybe you start with the testimonials and get a first-hand account of just what kind of experience they've had, and then reach out to a provider should that be the case. So because we don't have a whole lot of time, I want to get to you, Senator. I want to ask you if there was a final message you'd like to leave our viewers with. What is it? Or maybe some of our viewers are thinking, gosh, well, I'd like to help, I just don't know what to do. What would you like to leave them with?
We need their support. We need their advocacy. They need to contact their state senator, their state representative, their elected community leaders, and let them know how important this issue is, and that it should be, must be prioritized when we get back to the legislative session.
It should be, absolutely. And they can do that by
going to the internet, the Florida Senate, find your legislator, same thing for the House.
Sure.
And it will tell you all of your elected representatives from U.S. Senate to State Senate to Cabinet to House. And we just need people to be engaged.
Exactly.
Don't be quiet about this issue. If it's impacted you, there's no shame in coming out and saying, I want help, or I want to help my neighbor. I want to help my family member.
I love it. There's no shame in that at all. And like the Senator said, you can go find your representatives, find your state representatives all online. Check it out. Ask around. I know it sometimes can be a little intimidating, but you'll find the information you need. Get out, get involved in your community. Tell you every week. There's the website right there you can start with, cfbhn.org. We'll have a link for you on our CW44 as well. But don't go anywhere. We're coming back after this to wrap up this week's edition of Bayside. As always, I want to thank you at home for joining us this week on Bayside. And of course, Doris, thank you for being here. Senator Roose, a pleasure meeting you, and I really appreciate you being here, and extend my gratitude to Natalie as well. For you at home, I tell you every week, get out, get involved in your community. This is an extension of your family. By all means, you can start with logging on to cfbhn.org. Get all the information that we've talked about today. Reach out to your senators. The opioid problem is real and it is a crisis. Reach out to your senators, see how you can help. For now, I'm Shelly Sanders, host of Bayside. Have a great rest of your week.